Hello and welcome to a brief presentation on how Interact's talent management technology can help you implement best practices and have more effective management of residency programs. First, we look at the typical challenges that you deal with when managing residency programs. There's a lot of paperwork involved, therefore a lot of risk of losing papers or having mistakes made in the processing of paperwork. There's a very critical time element. A lot of things need to be done within a specific time frame, and there's a risk of missing certain deadlines. There are many different people involved in the process. There's the residents themselves, apart from the patients, obviously, and then the people that are helping in managing and assessing the resident and the residency program. Finally, there are many reviews that need to be done. And all of this basically means that there's an inherent risk, which is that you need to make sure that you have the right procedures and protocols implemented and followed, and eventually, obviously, that the patients are receiving the best care. So many of these processes are currently done manually in most hospitals, and therefore it's important to consider and to realize that these are time-consuming processes. They're very error-prone and they're not scalable. The more residents you have, the higher the volume of paperwork and the more difficult it becomes to manage all of it. A solution to all of this is technology. Technology can help you. It can help you with onboarding, of bringing new residents on board. It can help you managing competencies, handling their probation, doing residents' performance planning, and patient engagement planning. It can help you devise complete career plans for your residents. It can help you manage the training and learning requirements and deal with the scheduling component of the resident program. Finally, it allows you to manage health and safety, which is critical, and obviously to track disciplinary actions in case there is a need for that. Onboarding, in a few words, means handling the entire cycle from a resident before even the resident joins the residency program all the way through to the end when the resident leaves the residency program. Onboarding allows you to define all the different stages and make sure that different aspects are dealt with before joining on the first day of the program and the first week of the program, and the same thing goes for the first month and additional months. There are specific activities that need to be implemented and need to be taken care of in each stage, and these can be defined and made sure that they're not missed. The second critical element is the competencies management. Obviously, the whole purpose of the residency program is to make sure that the residents are gaining and exhibiting the right competencies. Now, it is critical, therefore, to define what those competencies need to be, at what stage they need to be able to present and demonstrate those competencies, how they will be assessed, and who's going to do the assessment. And to track all of this information, you need a competency management system. The residency probation planning I just mentioned will allow you to define exactly what needs to occur during the probation period when the resident has just joined. And therefore, that includes a number of ways of providing and obtaining feedback. And the quick feedback can be done at any time during the probation. It does not need to be held until there is a formal mid-probation assessment or an end-of-probation assessment. All of these items can be done through a system. Finally, the most critical thing, obviously, is to ensure that there's the right performance. And therefore, you define residency performance plans, which will enable you to specifically define what it is that a resident in a residency program needs to achieve, what are the particular goals, what are the competencies associated with the resident program that this particular resident needs to be familiar with and needs to be able to demonstrate, and how will they be assessed. Okay, that's what we do in a performance plan. Here's an example of a residency performance plan for a resident pediatrician, which contains knowledge and academic activity. It contains assessment of clinical and technical skills and attitudes and ethics, and it can contain anything else you want. The program managers and the advisors will define the exact benchmarks that are required from the resident, and will track the actual achievement, when this was achieved, and so on. Okay, beyond the overall and general performance plan, there's also the patient engagement planning, because apart from having a general review of the performance of the resident, it's critical that you have a clear picture of which competencies have been developed or have been demonstrated in a particular case, a particular patient engagement. Therefore, you can define specific goals and specific competencies that need to be developed with specific patient engagements. And the feedback is kept separate so that it can clearly be monitored individually. And the flexible scoring and rating mechanism allows you to have a lot of flexibility there. Okay, this is an example of how we would define specific goals that are job specific, obviously, depending on the particular residency program that we're dealing with, and this information can be very detailed. Okay, all of these components together allow you also to go and put together a career plan, a systemic career plan that helps you to develop the resident's career. And a career plan can contain up to 6 years of goals, objectives, and activities. And those activities can be lectures, they can be trainings, they can be symposiums, they can be rotations or round calls. It doesn't matter. It is all up to the requirements of the particular residency program. As an example here is a training plan, which is defined under learning management. Learning management will allow you to develop a structured learning catalog. It allows you to define both internal and external training courses, and even utilize external instructors and institutes. Okay, you schedule the training, and you do that ahead of time so that it does not conflict with other activities that need to be done during the residency program. The training plan will be available for everybody to see that needs to be aware of the detail. And you can see here an example of a pediatrician's specific training plan and the different times when he's requested to attend these. Scheduling and time management is absolutely critical to make sure that the program is managed in the most efficient way. Therefore, there is no limit on the number of and types of shifts that can be defined. They can be assigned to the resident based on the hospital and the specific residency program's requirements, and any number of work schedules can be created. There's a very easy to use schedule planner that allows those people that need to create these schedules to log in and have access to all the information they need to have. Obviously, being in a healthcare environment, health and safety is absolutely critical, and the system allows you to define all kinds of illnesses and injuries that may occur on the job, to make sure that the right reporting is in place, and to make sure that people are aware of the causes and how the actual event occurred, what the final treatment was, and what the outcome was. And this will all be part of the residency program details, so that we're aware of the real impact on the resident itself during the residency program. Finally, disciplinary actions can be tracked and can be kept in the resident's electronic record, so that everything is on file and there's no miscommunication or no lack of information when it comes to tracking what exactly occurred, what was the cause, or what were the details of the incident, and what was the final recommendation of the disciplinary committee. So the whole purpose of applying technology is really to automate things and to integrate different areas that may currently contain information that's separate and that's been duplicated many times. And in order to save time for the resident and for the program managers, and to allow them to focus on what's important, which is to develop the competencies, we want to get rid of a lot of the paperwork. At least we want to automate generating a lot of this paperwork and allow you to be more efficient. And for that purpose, you have the learning management module we've talked about, performance evaluations, which can be scheduled, can be put on the agenda, can be done through the system without lots of back and forth of paperwork. And that includes end of rotation evaluations, clinical skills evaluations, and much more. We also have time management, as we just went over, and disciplinary actions, as well as health and safety. The ultimate goal is to save time, and to save time in order to have more time for the more important aspect of the residency program. which is to develop the competencies and to do proper patient care. In order to save time, we need to have a unified electronic record where all the information is available. We need to have access to that information through the internet. Interact is a purely web-based application, so no need for installation of any software on the user's machines. Only the hospital's main computer system will contain the data and the application. And through the workflow, people will be reminded of specific tasks that need to be completed, of deadlines, and will be sent the reports they need. The outcome of all of this, and the final objective really, is to have a unified electronic resident record. Okay, that will contain general demographic information, education details, skills, experience, job details of the resident, but also his leave records. It will contain his competency evaluations, his performance evaluations, his residency plan and training plan. All the details will be in there. You will also see the resident certifications, his publications, speaking events and associations he's attended. All of this information is all going to be in one place. No more need to track papers which are in different places or may have not been turned in time, and so on. In addition to that, you will have the full history of the resident. You will have his work schedule and shifts, which can be viewed by him and his supervisor or advisor. You will have timesheets, the payroll details in case he's getting paid through the system, as well as other government documents that need to be kept on file. Finally, a few words about Interact. Interact is a global firm. We're based in Washington, D.C., and we are focused on helping organizations manage critical processes in human resource, payroll, and talent management. And we do this around the world. We have offices in the Middle East and in many different parts of the world. Our main focus is on healthcare, government, and higher education, but we also work in many other industries. We work wherever HR, payroll, or talent management are critical components in an organization's business, and where using technology can make a large difference. Finally, if you'd like to contact us, you can contact us directly at healthcare@2interact.us.